When providing care in a client's home, the most important safety practice is to A. Rearrange furniture for convenience. B. Observe surroundings and remove tripping hazards. C. Leave cleaning supplies near children. D. Keep all cords stretched across walkways. Answer B. Home health aides must maintain a safe environment by identifying and removing hazards such as clutter, cords, and loose rugs to prevent falls and injuries. A client with diabetes should have their feet inspected. A. Weekly by the nurse. B. Daily by the aide. C. Only when pain occurs. D. Only during doctor visits. Answer B. Daily foot inspection helps detect early signs of infection, sores, or poor circulation in diabetic clients, preventing serious complications such as ulcers or amputations. When helping a client bathe, which area should the aide wash last? A. Arms. B. Back. C. Face. D. Perineal area. Answer D. The perineal area is cleaned last to prevent spreading bacteria from the genital area to other parts of the body, maintaining proper hygiene and infection control. If a client starts choking and cannot speak or cough, the aide should A. Offer water immediately. B. Perform abdominal thrusts. C. Hit the client's back repeatedly. D. Wait until they turn blue. Answer B. Abdominal thrusts, Heimlich maneuver, help dislodge the object blocking the airway, restoring breathing and preventing suffocation. When transferring a client with one-sided weakness, the aide should A. Stand on the client's weak side. B. Stand on the strong side. C. Pull the client forward quickly. D. Ask the client to move alone. Answer A. Standing on the client's weak side provides support and stability, reducing the risk of falls during transfers or walking. Before feeding a bedridden client, the aide should first A. Lay the client flat. B. Elevate the head of the bed at least 45 degrees. C. Provide medication. D. Turn off the lights. Answer B. Raising the head of the bed prevents aspiration and allows easier swallowing during feeding, ensuring the client's safety. A client complains of dizziness while walking. The aide should A. Continue walking quickly. B. Support the client and help them sit down immediately. C. Ignore the complaint. D. Call family instead of the nurse. Answer B. The aide should prevent falls by supporting the client and helping them sit safely. The nurse must be informed of the symptom immediately. The correct way to measure a client's radial pulse is to A. Use your thumb on the wrist. B. Use your first 2 fingers for 1 full minute. C. Count for 10 seconds and multiply by 10. D. Estimate visually. Answer B. The radial pulse is measured with the first 2 fingers for 1 full minute to ensure accuracy, as the thumb has its own pulse and may cause errors. When assisting a client with a hearing aid, the aide should A. Wash it with soap and water. B. Keep it in place during showering. C. Check that it is turned on and properly fitted. D. Store it in the freezer. Answer C. Ensuring the hearing aid is on, fitted, and clean improves communication. It should be removed before bathing and stored in a safe, dry place. When recording vital signs, the aide must A. Guess if unsure. B. Record immediately and accurately. C. Wait until the end of the shift. D. Write them on scrap paper. Answer B. Accuracy and immediacy in recording vital signs ensure that the healthcare team can make safe, informed decisions about the client's care. A client with limited mobility develops redness on their lower back. The aide should A. Rub the area vigorously. B. Report it to the nurse immediately. C. Ignore it until it worsens. D. Apply lotion without direction. Answer: B. Redness may indicate the start of a pressure ulcer. Prompt reporting allows early intervention and prevents further skin breakdown. When using standard precautions, the aide must wear gloves when A. Making the bed. B. Talking with the client. C. Handling body fluids. D. Serving food. Answer: C. Gloves protect the aide and client from infection whenever contact with blood, urine, or other body fluids is possible. A client becomes angry and starts shouting. The aide should A. Shout back to assert control. B. Remain calm and listen respectfully. C. Leave immediately without explanation. D. Call the family to handle it. Answer: B. Staying calm and listening helps de-escalate emotional situations. The aide's patience and empathy build trust and prevent conflict. When documenting care, the aide should A. Use personal opinions. B. Record only positive events. C. Write objective, factual information. D. Wait until the end of the week. Answer: C. Documentation must be clear, factual, and objective, focusing on observations and care provided, not personal judgments. The most accurate method to measure body temperature is A. Oral thermometer. B. Axillary method. C. Rectal thermometer. D. Forehead touch. Answer: C. The rectal method provides the most accurate core temperature reading, especially for clients who are unconscious or very young. When helping a client use a walker, the aide should A. Hold the walker and move it for the client. B. Instruct the client to move the walker first, then step forward. C. Pull the client forward. D. Move the walker and feet together. Answer: B. The client should move the walker first, then step into it. This promotes balance, stability, and independence. If a client refuses a meal, the aide should A. Force them to eat. B. Respect the refusal and report it to the nurse. C. Offer the same food later. D. Ignore the situation. Answer: B. Clients have the right to refuse food. Reporting it ensures that the nurse can assess the client's health and nutritional status. The best way to prevent the spread of infection is by A. Wearing gloves all day. B. Washing hands frequently and properly. C. Using hand sanitizer once per shift. D. Avoiding contact with clients. Answer: B. Hand hygiene is the most effective method of infection control, preventing the transfer of pathogens between clients and caregivers. When cleaning a client's dentures, the aide should A. Use hot water to sterilize them. B. Hold them over a basin of water or towel. C. Use bleach for disinfection. D. Scrub roughly with a hard brush. Answer: B. Holding dentures over water or a towel prevents breakage if they are dropped. They should be cleaned gently with cool water and a denture brush. When making an occupied bed, the aide should A. Ask the client to stand. B. Keep the side rails up for safety. C. Pull the sheets quickly. D. Leave wrinkles for comfort. Answer: B. Raising side rails during bed making prevents the client from falling and ensures their comfort and security throughout the procedure. When assisting a client with range of motion exercises, the home health aide should A. Perform the exercises quickly to save time. B. Stop immediately if the client complains of pain. C. Force the joint beyond its normal range. D. Perform exercises only on the stronger side. Answer B. Range of motion exercises should never cause pain. If the client experiences discomfort, the aide must stop and report it to the nurse. Forcing movement may cause injury to the muscles or joints. A client with COPD is having difficulty breathing. The aide should A. Lay the client flat for comfort. B. Encourage slow, pursed lip breathing. C. Encourage the client to hold their breath. D. Turn off the oxygen supply. Answer B. Pursed lip breathing helps improve oxygen exchange and control breathing. The aide must ensure the client sits upright and remains calm to ease respiration. When assisting a client with toileting, the aide should A. Leave the door wide open for easy access. B. Stay nearby to ensure safety and privacy. C. Ignore the client's call for help. D. Discuss personal matters during the process. Answer B. Staying close ensures safety, especially for clients with limited mobility, while maintaining dignity and privacy during toileting care. If a client is incontinent and their skin appears red, the aide should A. Leave it uncovered to dry out. B. Clean gently and report the condition. C. Use talcum powder without direction. D. Ignore the redness. Answer B. Redness may indicate early skin breakdown. The aide must clean and dry the area gently and inform the nurse for further evaluation and prevention of sores. Which of the following should be reported to the nurse immediately? A. Mild hunger. B. Increased confusion or sudden agitation. C. Refusal to watch TV. D. Temporary tiredness. Answer B. Sudden changes in mental status, such as confusion or agitation, may indicate infection, medication side effects, or other medical emergencies requiring prompt attention. Before assisting a client to ambulate after surgery, the aide should first A. Give the client a meal. B. Allow the client to sit on the bed edge to dangle their legs. C. Stand the client up quickly. D. Remove their compression stockings. Answer B. Allowing the client to dangle their legs helps stabilize blood pressure and prevents dizziness or fainting when standing after prolonged bed rest. When performing post-mortem care, the aide should A. Rush through the process. B. Handle the body gently and with respect. C. Ignore family members. D. Leave the body in soiled linens. Answer B. Post-mortem care must be performed with dignity and respect. Handling the body gently and maintaining cleanliness honors the client and their family. A client reports feeling sad and hopeless. The aide should A. Tell them to cheer up. B. Listen and report the feelings to the nurse. C. Ignore the complaint. D. Change the topic immediately. Answer B. Expressing sadness may indicate depression or emotional distress. The aide must listen empathetically and report this to the nurse for professional assessment. When handling soiled linens, the aide should A. Carry them close to the uniform. B. Shake them to remove debris. C. Place them in a leak-proof laundry bag. D. Leave them on the floor. Answer C. Soiled linens should be placed directly in a leak-proof bag to prevent contamination and maintain infection control within the client's home. If a client begins to have a seizure, the aide should A. Try to hold the client down. B. Insert an object into their mouth. C. Move objects away to prevent injury. D. Run for help without staying. Answer C. During a seizure, safety is the priority. The aide should move dangerous objects away, stay nearby, and report the event after the seizure ends. When providing catheter care, the aide should clean A. From the catheter tube toward the urinary meatus. B. From the meatus outward along the catheter. C. In random circular motions. D. Only around the thighs. Answer B. Cleaning from the meatus outward prevents bacteria from entering the urinary tract and causing infection, maintaining sterile direction. Which is the correct method for identifying a client before providing care? A. Ask the family for the client's name. B. Check the care plan or identification band. C. Assume the client's identity based on the room. D. Call the client by a nickname. Answer B. Correct identification ensures safety and prevents medication or care errors. The aide should confirm using official identification methods. The first step when a fire occurs in a client's home is to A. Try to put out the fire. B. Rescue anyone in immediate danger. C. Collect personal belongings. D. Call the family. Answer B. The RACE procedure starts with rescue, ensuring all clients and aides are moved from immediate danger before alerting emergency services. When cleaning hearing aids, the aide should A. Use alcohol wipes. B. Wipe with a soft, dry cloth. C. Soak in water overnight. D. Use household cleaners. Answer B. Moisture and chemicals damage hearing aids. They should be gently wiped with a dry cloth and stored safely to maintain function. When documenting care, corrections should be made by A. Erasing and rewriting. B. Using whiteout. C. Drawing a single line through the error and initialing. D. Leaving it uncorrected. Answer C. Documentation corrections must remain legible and accurate. A single line with initials maintains integrity of the record and complies with healthcare regulations. When assisting a terminally ill client, the aide's primary focus should be A. Comfort and emotional support. B. Encouraging physical therapy. C. Increasing medical procedures. D. Forcing the client to eat. Answer A. Comfort care and emotional support help maintain dignity and peace during end-of-life stages, which is the core of hospice and home care. To prevent dehydration in elderly clients, the aide should A. Offer fluids frequently during the day. B. Limit water intake. C. Offer fluids only at mealtimes. D. Avoid fluids after 5 p.m. Answer A. Elderly clients are at higher risk of dehydration due to decreased thirst sensation. Regular fluid offering supports health and prevents urinary infections. The proper way to lift an object is to A. Bend from the waist. B. Keep legs straight and back bent. C. Bend knees and keep back straight. D. Twist while lifting. Answer C. Bending at the knees and keeping the back straight protects against back injury and uses leg muscles for lifting safely. If a client begins to cry during care, the aide should A. Ignore the client and continue. B. Offer comfort and allow expression. C. Leave the room immediately. D. Tell them to stop crying. Answer B. Emotional support is part of holistic care. Listening and offering comfort shows empathy and builds trust with the client. Before disposing of sharps such as needles, the aide must A. Recap the needle carefully. B. Break the needle tip. C. Place it directly into a puncture-resistant sharps container. D. Dispose of it with household trash. Answer C. Use needles must go directly into a sharps container to prevent needle stick injuries and infection, following universal safety guidelines.